I was recently asked from a patient if they should pee after sex every time to make sure that they don't get urinary tract infections. And this is a common practice for many women to make sure they urinate after any type of penetration to prevent UTIs. And the reasoning behind this is that the vagina and the urethra are very close together. And after the friction from penetration, there is a increased risk that bacteria that naturally lives in the vagina can then get into the urethra and then up into the bladder to cause a bladder infection or a urinary tract infection. And so the theory is that if you go to the bathroom right away, that your urine sort of flushes out any bacteria that might be lingering around and then reduce your risk for UTIs. We actually don't have any real clinical evidence or data or research to back this up. However, it is a reasonable thing to do and not a bad practice. But I do think if you are someone who is getting recurrent UTIs all of the time after intercourse, I think it is definitely worth getting an evaluation to check and make sure, are these true UTIs? Are you actually really having bacterial infections? There are other conditions, other bladder conditions that can sometimes mimic the sensation of UTIs. We see a lot of frequent UTIs in women who are in menopause. Maybe they don't have good hormone health down there. I sometimes also see it in women who are on birth control pills. I think peeing after any type of penetration, intercourse is a fine practice. I think staying hydrated is key. Practice just good vulvovaginal hygiene with new partners, use condoms. And, if you feel like urinating after intercourse is a good practice for you because you feel like it helps, it can hurt.